Just look at my finger here and around the sides here. Just gonna look in the top as well. Okay, yes. It is looking a little bit red. You just look really uncomfortable. Okay, well, don't worry. I'm going to help with that, okay? Now, I just need to make sure that I answer some questions first, just to make sure I have a really good understanding of your health situation, okay? So, are you currently taking any medication? Okay. That's good. Any recent falls or trauma to the head? Okay. Any history of glaucoma or cataracts or blindness or early onset blindness? Okay. Any headaches? Are you experiencing any headaches? Some here, all the way along to about there. Okay. Any on the top of the head? Some there, just a little bit, and any on this side. Okay, and on the back of the head. Okay. And any prolonged use of screens, computers, laptops, TVs, phones, or using any kind of warm filter just to block the blue light. Okay, you should probably look at getting one of those, especially anything sort of after 3 o'clock. You're going to want to put a warm filter on. Okay, and let's have a look. There's a little bit of redness here. Is that anything? It's not related. Okay. Just a bit of irritation. Okay. I'm just going to make a note just in case. Alright, is there anything you want to let me know? Anything you want to add? Alright then. So I'm just going to have a look first. You just look at my nose, just so I can. Yeah. Okay. Just look at my finger here. Just following my finger. Is there any pain? Okay. A little bit that side. Alright. And going up. And going down. Any pain there? A little bit. Okay. Alright. I'm just going to have you look here. Now here. No. Okay. A little bit of uncomfortableness. Okay. So not quite pain. And looking here. Perfect. I'm just going to have you close your eyes. And now open. And now close. And then open. Okay. So upon closing and opening, okay. Right. Let's have a look. just going to have you close your eyes just for a moment. I'm just going to allow some of the liquid to build up in your eyes, so just keep them closed. And now open. Okay, discomfort upon opening. Okay. Just going to pop some gloves on because I think I'm going to need to touch the area. Okay. Alright, so I really want you to be as relaxed as possible, okay? So let's just make sure, just starting at your toes, just really relax everything, okay? So just letting the muscles just relax, relaxing the knees, the hips, nice and relaxed. Okay. Just relaxing everything. Arms, hands, you can just place upwards. Okay. Just relaxing the shoulders and the head. Just allow it to be free. And the jaw as well. Just relaxing the jaw. Alright, so I'm just going to come in a little bit closer. I'm going to start on this eye. So, just keeping it open, feel free to blink when you need to blink. Alright, so some redness and a little bit bloodshot. Just going to compare to this side. Just going to pull the lid down slightly. That side. That looks okay. So when you're experiencing pain, can you tell which side it's happening on? Okay, you can't. So it's definitely happening on this side. So I'm just going to close this eye, and if you just try to blink with the other eye, okay, you see it's not hurting on that side, okay, so there's something in your eye, alright. I'm going to do a few more tests and do a little bit of investigation work, and then I'll try and get it out for you, okay. So I'm just going to be comparing the two eyes as it's a good way to tell what's a normal part of your eye and what's not. So I'm just comparing the two. Just gonna get your head nice and straight. So I'm just going to test the sensitivity around the eye. Okay. So you can close your eyes or keep them open, it's entirely up to you. So, can you feel that? Okay, and that. Okay. Can you feel that sensation there? Right, just going under the eye. Can you feel that? You can. And around the sides here. And along the top. You can, okay. And on this side. There. You can. And on the top. Okay, I'm just going to go in with slightly sharper end. It's not sharp, it's just slightly sharper than the dull end. You recognise that sensation? Okay, how does it feel? Okay. And that. Okay. And that. Okay. And can you recognise the difference in sensation? You can. And then just to compare on this side, you feel that? And that. Okay. And that. And that. You can. Okay, good. It's going to go a little bit further out. The trigeminal nerve and the facial nerve are connected all the way around both eyes. So let's go here. Okay, and on this side you can feel that. Alright, I'm just tracing the nerve, any tingling as I move this across the face. No, good. So just let me know at any point if you do feel any tingling. So we may have a problem with the nerve as well. As far as I'm aware, so far, once we do remove what's in your eye, it should take up to 4 days, and then there will hopefully be no sensation at all left. I mean, no bad sensation. You will have sensation in your eye. Okay. Just following this. Just along the eye. Go further down around the nose area and on this side. Does that feel okay? On the forehead, down around the lips. Okay, full sensation. That's really good. I'm just going to follow this on now with some light pressure. So again, I want to know if there's any tingling or pain or numbness. Okay. Okay, any difference in sensation from one side to the other? No, okay. So before I go into the eye and see if I can see what's in there, I just want to double check that you haven't got a temperature or if there's anything else going on. Okay. So, okay. I'm going to go into this ear. Okay, that's good. And then into this ear. Okay. I'm just going to go across the top of the head. Just do that one again. Alright, perfect. You don't have a temperature, which is good news. Alright, so I'm just going to go in with a little mirror. I'm just going to pull down the eye to begin with. So I'm just pulling down the lid, just looking. Whether I can see anything. I can see something. Just gonna do the same on the sides. See if I can see anything. Just gonna look in the top as well. Just gonna compare it to the other side. It looks like there's a tiny little eyelash. That is all it looks like it is. So very straightforward. And I'll definitely be able to take that out for you. Okay, I'm just trying to get a good look. Make sure I'm correct. Yeah, there it is. Okay. looking directly at me. I'm just gonna see if I can push it upwards, okay? See if I can just take that out. It's nice and relaxed. There it is. Yeah, very tiny little eyelash. How's your eye feeling? Still a little bit sore, yes, it will be. Just to begin with, it feels a little bit like there's a grain of sand in the eye. Yeah, okay, so I'm just gonna massage the eye area. Just massaging. Okay, eyes filling up with a little bit of water. Just wiping. I'm just gonna keep going. Okay, I just want to run some tests now. Okay, so just have you follow my fingers. Okay, how's that feeling? A little bit of discomfort, but it's better. That's good. Just looking here, and here, here, and here. Okay, I'm just gonna close this eye. Okay, that's when you go down, yeah, because that's where the eyeball is pressing. So it's obviously just created a little bit of inflammation. So just as you look down there. If you just stay looking at my nose, just let me know when you can no longer see my fingers. Good. Let's check this side. So does that feel alright? Yeah. Alright, just looking at my nose. Just tell me when you can no longer see my fingers. Okay, perfect. Alright. few questions. So I've ruled out any signs of infection or inflammation. Okay. I've ruled out any signs of infection, but there is some slight inflammation, but we're expecting it to go down. Okay. There are no other concerns from myself. Okay. So you can go ahead and give this to reception, and they're going to give you some eye drops just to keep the eye lubricated. Okay. So I'll just give that to you. Perfect. Alright, let's have one last look and make sure. Okay. So it has got a little bit more red, which has to be expected because I was pushing the area. So I think you're going to be perfectly fine. Just go home, have a nice bath, get an early night, and just relax. Alright, I'll see you again.